This video is designed to share findings of our Immigrant study that intended to explore breastfeeding challenges of immigrant mothers in Saskatchewan, Canada, and seek their recommendations on ways to improve breastfeeding practices of immigrant mothers. Dr. Sheila Harani and her team acknowledge the support of Saskatchewan Health Research Foundation that funded this study. Study participants recommended that all healthcare settings in Saskatchewan, Canada must be breastfeeding friendly, and implement baby-friendly initiatives to promote, protect and support breastfeeding practices of immigrant mothers. Immigrant mothers acknowledge that role of supportive healthcare providers is crucial in supporting their breastfeeding practices and positive experiences. Study participants recommended that every mother should be provided with need-based breastfeeding counseling in healthcare settings. Immigrant mothers highlighted the importance of breastfeeding knowledge so they can effectively breastfeed their babies. Study participants shared that every mother should be provided knowledge on breastfeeding positions, ways to pump breast milk, and strategies to maintain their breast milk supply. Mothers shared that healthcare professionals must discuss breastfeeding early in the pregnancy so they can make informed decisions and plan to breastfeed. As immigrant mothers belong to different cultural groups, study participants highlighted that it is essential that healthcare settings provide culturally sensitive care to everyone. In this regard, mothers must be provided culturally appropriate food during their admission to the hospitals. Immigrant mothers shared that language barriers affect their ability to fully communicate their needs and share their health issues. They recommended that there must be interpretation services in all healthcare settings. Mothers shared that there must be a breastfeeding room in community clinics so they can respond to their child's breastfeeding needs. Mothers further recommended that there must be helplines for breastfeeding mothers that provide them timely and need-based breastfeeding counseling in their preferred language. Immigrant mothers are at high risk of mental health issues, especially during the postnatal period. Study participants emphasized that the healthcare system should prioritize maternal mental health and provide them with need-based support. Mothers further recommended that there should be more frequent community-based follow-up care by healthcare professionals, especially during COVID-19. While highlighting the importance of social support, mothers shared that breastfeeding advice and support from friends and family help them in continuing their breastfeeding practices. Mothers highlighted that support from their spouse or partner is highly important in Canada where they do not have regular contact with their extended family members in their home countries. Immigrant mothers reported that there is a lack of acceptability of breastfeeding in many public places in Canada, including airports, public parks, bus stops, transit services, and restaurants. Many public places do not have a private space for mothers to breastfeed. Lack of adequate breastfeeding support in public places causes more challenges for mothers to respond to their child's hunger in public. Immigrant mothers shared that their breastfeeding practices should be supported in all public places. Many immigrant mothers shared that combining breastfeeding with employment is challenging because their workplace settings often lack breastfeeding support. They recommended that there should be enough privacy, breast milk storage facilities, work flexibility, and accommodation to support their breastfeeding practices. Mothers recommended that there must be community-based programs and organizations in Canada that promote, protect and support their breastfeeding practices. Immigrant mothers further recommended that government should continue to invest in immigrant programs to promote the well-being and health of the immigrant families.